future healthcare providers of TikTok. My name is Kels, and I'm coming to you live from my fire escape. Why am I out here? Well, because as healthcare providers, it's critical that we understand the sociological factors that lead our patients to their current health statuses, so that we can be more empathetic towards our patients, as well as more proactive in influencing health policy. I just watched a documentary called Escape Fire, which explores the many ways in which the United States healthcare system is essentially a fire that no one can escape. And since no one knows fires better than the state of California, I'll be taking you on a tour of San Francisco along the way. People on a budget often turn to less healthy options like a 99-cent burger over a $6 salad at McDonald's. But in the long run, even though it seems like we're saving money, these make the national costs of healthcare skyrocket because of the amount we spend on the consequences of obesity. Don't believe me? Come to work with me. I work at Joe and the Juice, which is a health shop that specializes in making juices. My favorite thing on the menu is this, Joe's Green Mile. It consists of apple, ice, spinach, avocado, broccoli, and lemon. Now, if I actually listened to my manager and paid for this, I would be spending $11.40 before tax for only 240 calories, which is essentially just a healthy snack. So while this is delicious, let's see what this money could get me elsewhere. I'm so sorry I didn't see you there. I feel so rude. We're gonna see what some money can get us elsewhere besides just Joe and the Juice. So I just went to Taco Bell and I bought 3 Doritos Locos Tacos Supreme, sub beef for beans of course, and I got a Mountain Dew Baja Blast. In total, I spent $9.79 and I ended up getting 960 calories out of this meal. You may be wondering why I'm giving you a Taco Bell haul. Well, the reason is because I was able to get exactly quadruple the calories that I got from my juice at Joe and the Juice, yet I spent $1.61 less. Now you may be thinking, okay, it's only $1.61, but check your privilege, my friend. That can be a lot to people who are on a really tight budget. And also keep in mind, if I needed 960 calories to be full, that would be over $40 to achieve that same amount at Joe and the Juice, which is pretty unrealistic for one meal. So really, Taco Bell is a lot cheaper. And you may be wondering why the big price difference? Well, that's why we are at City Hall in San Francisco. So ultimately, the reason that fast food is so cheap is because of legislature. That's a huge contributor, and it's pretty much because the Department of Agriculture in the United States subsidizes things like corn, sugar, wheat, as opposed to things like apples, carrots, and celeries. So this allows brands to offer really, really, really cheap food. My sour cream just spilled all over my laptop, but at a really affordable price point, even though it's not the best for your health. Whereas things that are really, really healthy and made solely of fruits and vegetables like this juice, expensive, not affordable. So yeah, that is why a lot of nutritionally dense foods are very out of reach for a lot of the population. And this really gets at something we will be discussing further along in this video, which is upstream versus downstream solutions. So to talk a little bit about downstream solutions, let's use the example of obesity. Speaking of fires, there's one behind me. So using the upstream versus downstream discussion points, let's talk about things like obesity. So a downstream solution would be to do specialized things like putting in splints because people are having heart attacks left and right for unmanaged diabetes and hypertension and all of the cardiac problems that follow obesity. A more upstream solution, but not the most upstream solution, would be preventative care. So that would be people like your primary healthcare providers, or just being able to prioritize your health in ways like choosing Joe and the Juice over Taco Bell. the most upstream you could really get would be to look at the sociological factors that are driving people to these health statuses. So that would be, why is it that low-income people are struggling with obesity? Well, if we look at that, we can see that it's not just because they're opting for Taco Bell for the fun of it, it's because they can't afford more nutritious and more nutritionally dense foods. And who are these low-income people? Well, it's people of certain races who are systemically oppressed. So that is how you look at the different levels of care. So pretty much downstream is after the problems happen. Midstream is like kind of preventing it from happening, whereas upstream, like I said, is more these sociological factors that really at first glance don't even have anything to do with health, but they are really the demographic influences that affect every realm of our being, including and especially health. So yeah, thank you for coming with me to City Hall. And next we are going to Safeway. Hi, I'm coming out here from Safeway in San Francisco. Safeway is at the forefront of innovation when it comes to employer healthcare because the CEO decided to imitate driving insurance. Now, the way they did that was by looking at the fact that when you buy car insurance, they base it off of your driving record, aka your behavior. They decided to emulate that by giving the Safeway employees a discount if they exhibited certain health behaviors such as not smoking, if they had a BMI less than 30, and if they had things such as hypertension under control. This was a great incentive for employees to get their health into tip-top shape because it allowed them to save thousands of dollars per year. Sounds like a safe way to promote preventative care and promote health. We are going to take a small pit stop. Actually, we're not stopping. We're just crossing by the Healthcare Dispensary. This is a dispensary for marijuana. We will not be stopping here because, as we learned in the Escape Fire documentary, about 70% of health conditions and, well, rather illnesses are preventable by behavior. So we will not be stopping here or any liquor store or anything that promotes bad health behaviors because, like we said, 70% of illnesses could be preventable by behavior. Our last stop is the pharmacy. So the reason we're at the pharmacy is because we often turn to pharmaceuticals to manage symptoms of problems rather than, one, addressing them upstream as we talked about in the Taco Bell dough and the juice example, or allowing them to do preventative care like we talked about in the Safeway example. The reason the pharmaceutical companies are kind of a bad thing is because they are very, very profitable at the expense of patients, which means at the expense of the United States and our national healthcare costs. Now, this is problematic for a variety of reasons. As we saw in the documentary Escape Fire, there are treatment plans other than pharmaceuticals that can be really, really helpful for people of all different disease types. We learned about how lifestyle changes can prevent cancer by altering the length of telomeres, and we also learned that things such as acupuncture and other alternative medicines can be really helpful for people with conditions such as PTSD from war. Now, with all of this in mind, let's also talk about the fact that it's been proven primary care providers are single-handedly the most helpful resource when it comes to health promotion for patients. They have the largest overall impact on patient health in a very positive way. Yet, primary care providers actually make about half as much as specialist physicians. This is problematic because specialties, while they are critical in healthcare, are more of a downstream approach because you typically only see them once the condition has already developed, whereas primary care physicians are preventing problems from occurring in the first place. So I encourage us to all consider ways in which we can turn away from prescribing a medication for everything under the sun and instead turn to alternative medicines when appropriate and supervised by a physician, as well as dedicating more monetary resources and other resources to supporting primary care physicians rather than solely doing specialty. Thank you for coming with me on our tour of San Francisco, where we reviewed the key concept from the documentary Escape Fire. We didn't get a chance to talk about this yet, but one of the largest problems that we're facing with healthcare is that primary care providers are pressured to get money based on the number of patients they're seeing rather than the quality of care they're providing. So So it actually really financially harms these physicians to go really in depth with their patients when they meet with them and really unpack what they could be doing to better their health and prevent illness altogether. Instead, they're pressured to spend the least amount of time possible, and on average it's about 7 minutes per patient, which is not nearly enough. About how pharmaceutical companies really push for drugs to be given for pretty much every malady rather than exploring all their alternative medicine options such as acupuncture under the supervision of a physician, despite the fact that these are proven to help with things such as PTSD in war veterans. We also explored how things such as demographics like race can affect health because that affects their socioeconomic status, which may impact the foods they're able to eat, which was given in the Taco Bell versus Joe and the Juice example. And lastly, we talked about how approximately 70% of diseases are preventable by behavior, so we will be skipping the smoke shop altogether today. And also talked about Safeway and how they are pioneers in terms of healthcare for employees. So that should be good. And again, I'm your host, Kels. Thank you for coming on this tour of San Francisco. Have a great day.